So that kind of leads me into my next section of questions about e-learning. It was something people weren't so sure of after the spring semester. I know you guys have made some changes. One thing a lot of parents have told us is that there really isn't any live sessions with their students and their teachers on those e-learning days. And that's, they said, a concern for them because they thought they'd have at least a little bit of contact.
We have rolled out some more structured requirements for carrying out e-learning. They went out last week, so they should see some differences in that. Now, we do have some teachers that are literally teaching the students in front of them and live streaming to their students at home. They have to be in the position to be able to do that. Well, every teacher is not yet ready or able to do that. We're also working with schools on strategies to utilize some teachers. Maybe you're a teacher and you're particularly good at math and you're adept at technology. Maybe you do some math lessons for the whole second grade or the whole third grade. But the intent was to roll out new content on days they're there, them to go back and practice it, and then be able to ask questions of the teacher. That's sort of the basic design. There are other components to it. So that's a place we don't believe that we're doing as well as we should, and we have put into place things to strengthen that. And when we're talking about e-learning, we're talking about the students who are attending the brick and mortar school but are at home some of the time. Our virtual program, what we believe, is moving along exceedingly well, but those, again, those teachers have dedicated time to be live with their students.
And so with the e-learning, can you tell me some of the changes or the stricter guidelines that you're implementing? I mean, what were some of the problems that you were seeing?
Some of the problems was a lack of consistency in when teachers were present. When I say present virtually. So establishing particular times and amounts of time as opposed to suggestions or recommendations, bringing some of those into as requirements. And also, as we talked about, the structure. How should you present new material? What should you use your time virtually for? And what should you use your in-person time? Because in-person has to be, to a degree, split between new material and review. Now, if you're really good at flipping a classroom, you might do your new material virtually and then use your 2 days in person to fix anything that needs to be fixed. That's another approach to it. So there's some varying approaches, but you need to be using one of these 2 or 3 approaches. So hopefully they will notice a positive effect of those changes.
And do you have a message for parents and students who they just are overwhelmed right now with the virtual or with the e-learning? You know, parents may be juggling multiple kids in different grade levels, or even just one who is really having a hard time. What would you say to them? Well,
the first thing, talk to your child's teacher, talk to the principal if you have concerns. The other is, and sometimes we forget this and we lose it in the bigger message, the tremendous power of the in-person time. Because now, at the elementary level, our classes are relatively small in a regular school, on a regular day, in a regular year. So you're talking about class sizes anywhere in first grade from 15 or 16 to about 18. But even when you get past first grade, you're talking about our biggest class in elementary school. We have a handful of 5th grades with 26 in those classes. Well, that means the 2 days they're there, that teacher's spending time with 13 students. The intensity and the positive effect of the intensity of that time helps to a large degree offset the 3 days they aren't there. One of the things, if you talk to people who have taught homebound, or who have noticed the effects of homebound instruction on students. When I say homebound, we're talking about students in a regular school year, in a regular class. They have some medical issue, and they're out for more than 5 days, and they have a homebound teacher. They have one teacher that serves them 5 hours a week total for all subjects. So not a specialist in every subject, but one teacher serves them 5 hours every week total, but it's one-to-one. There are very few students that ever return from homebound Now there are some, but they're very few in number that aren't ahead of their class because of the intensity of working one-to-one. And what people that teach homebound, when they've done it for a little while, what they really figure out is, I don't need to talk to you about what you understand. I need to talk to you and help you with what you don't understand. So I pretty quickly try to assess what it is you're having trouble with, and let's focus on that. So it gives you that same kind of power if you're thinking about having somewhere between 9 and 13 or 14 students in front of you, how much one-to-one or one-to-two time you can have with those students and being able to truly focus on what it is you don't understand. That's what a lot of times teachers struggle with that when they have everybody present, because they'll have a group over here doing something while they're trying to work with a smaller group. So there's a power in the sizes of those classes that are physically in front of them.
Is there a fear, though, that those distant days where they're doing e-learning at home could offset some of the progress they might be making when they're in those smaller classes?
Well, yeah, I think that's always a concern, that there is a significant amount of time that they're not present. This is not an ideal situation, but I think that's true of everything. Everywhere you go, things look different. If you go, I think this is system-wide with Prisma affiliated medical providers. I happened to go to one the other day. It had nothing to do with COVID, and there was nobody there that had anything to do with COVID. It was a dermatologist's office. The patient by themselves, no one else with them. You have to wear a mask the whole time you're there. You walk in the waiting room and every chair is 6 feet apart. Get your temperature taken, go through this checklist, same kind of questions we ask our employees when they come to work. You go to various retail establishments, you got in a line, they got you marked out 6 feet apart. You go inside a restaurant, there's not somebody sitting at every table. Most stark thing that stands out in my mind was watching Clemson, that's my alma mater, but watching a football game in a stadium for 80,000 people, and there were 19,000 there. So there's all these precautions and changes in place that are certainly not what we would like or prefer, and may not be the most effective way to do things. But the condition we find ourselves in have compelled us to do that. And when you think about it, and you think about those places I was used as examples, there's only one place I can think of in our community where on a regular basis we would bring somewhere between 18 and 34 or 35 people together, not counting the teacher or aide, and put them inside 800 square feet and leave them there either for an hour or an hour and a half or at the elementary level all day. That close together in 800 square feet. I can't think of an example like that anywhere in this community. And I would say to people to think about that exposure that those teachers have, and I can't think of a place that replicates that. Now, obviously, there are people in the medical profession that are exposed to people that are COVID positive, and they follow the appropriate medical protocols, and they do things to keep themselves safe. So they are certainly probably more directly exposed to a known active case, or perhaps an unknown yet active case. But even in that scenario, you don't have 22 people or 32 people in an 800 square foot room all day. So it's a different set of circumstances. And teachers and all of our employees, they're a part of this process because they are committed to it. They believe in what we're doing. They believe in the impact they're having on students and the impact they're having on the community and on our state and our nation by what they do. But it wasn't something they signed on to do with the knowledge of having to deal with this kind of level of medical issue. I don't think that's anything anyone ever imagined. So we're doing what we believe is the very best that we can do given the circumstances and ensuring that we protect those that are in our care. And that's not just our students, that's our employees, and it's also not just teachers. It's our employees throughout the system. We have a moral and ethical and a legal obligation to protect them.
What kind of data are you seeing so far from students to kind of evaluate academically how they're doing, or even, I know attendance was a big issue in the spring. What kind of numbers are you seeing to gauge where students are at?
Well, because we do attendance so very differently with this blend, because really the part where they're at home, their attendance there is gauged on them checking in and doing their work those days. So it's hard to compare in-person attendance and like if you went back and looked at last year's time, because we'd be marking you present. That didn't necessarily mean if you're a Monday, Wednesday person, it didn't mean you were necessarily sitting there all day Tuesday and Thursday. It meant you did those things you were supposed to do on Tuesday and Thursday. So it's hard to draw that comparison on attendance. There's a lot of attention drawn to the number of students lost. You heard that probably discussed last spring. We had a total of 54 students that we couldn't account for. Now every year we have a movement of 11 or 12% of our students in and out of the district, and about 8% moving within schools within the district. So the idea that we somehow lost track of a lot of students, in our case, that's not substantiated by fact. There might be some districts in the state where that was true. Right now, the only measures we have would be the few, if you're looking like at state comparisons or national comparisons, would be the test data that we received from last year. And so far, everything that has been publicly released, and even the ones that we have that are currently embargoed, they actually all show an improvement. Now those are high school level AP, SAT, and we have a preliminary but embargoed graduation rate. They all show improvement. Now we do assessments inside the system. So now it's early in the year, so they've done an assessment. We use T21 Mastery Connect. Our teachers administer those assessments, and they're administered for teaching purposes. How much do these students know about this, and what areas do I need to work on? So during the course of the year, we will have that data to look and see how they progress from the first of the year when they came back into school through different milestones throughout the year. But right now, we don't have a marker. We're in the process now of giving the first one. So we'll have subsequent markers during the year to give us an indication of the progress they're making or the lack of progress they might be making.